hello. Welcome to Brain Injury Professionals Casual Conversation. This stems from Brain Injury Professional Magazine, which is a publication of NABIS, North American Brain Injury Society, and also IBIA, the International Brain Injury Association. NABIS is a nonprofit that was formed in 2003, and its principal mission of NABIS is to moving brain injury science into practice, which is what we're going to do today. We're going to talk with researchers. My name is Catherine Price-Snedeker. I'm a licensed clinical social worker. I'm also the founder and the CEO of Pink Concussions. And Pink Concussions is also a nonprofit that focuses on women and girls and brain injury and avocation, research, and events. So this is our virtual event, and we're very excited that IBIA and NABIS has allowed us to come on and focus the attention on this magazine, which I was very grateful and honored to be the guest editor. So today we're going to talk to some of my really good friends in Canada. And if you don't know, Canada is really a hotbed of concussion research, and with the background in hockey, really the research goes far back and is very deep. Three people I'd like to introduce you to today. The first is Andrée-Anne Ledoux, and I would like you to give us a little background to the people on the call today.
Great. Thanks for having me on, Catherine. This is really appreciated. So as Catherine said, my name is Andrée-Anne. I'm a scientist, a neuroscientist at the Children's Hospital of Eastern Ontario. My background originally was in neuropsychiatry. I did schizophrenia research and neuroimaging. And after having 3 kids and not having a lot of opportunity in my region, I switched to concussion. So now I do concussion research in the pediatric world, and I do as well neuroimaging with them. And I test out different interventions such as physical activity or mindfulness-based intervention to try to really empower these kids to inspire them and to give them, to make them a bit more resilient after having a concussion. So that's a bit my background.
And we first met actually in Rome. You gave a presentation, and I literally think I dragged you out of that presentation to then present at the Pink Concussions first pediatric event. Because the way that you talked about not only sex of the children, but the ages from one age group to another. And I don't think we do enough of that.
Yes, no, I agree. I think throughout the development of a child, and even in adulthood, right? If you look at the brain and how the brain develops, and afterwards how the neurons in your brain sort of, or your memory starts to decline after a certain time. I think it's important to look at age or different age group population when we study concussion and TBI. So so this was possibly the first study that really regrouped age groups and looked at sex differences.
Well, I do hope to talk about that a little more in the call. And then Nick, I can't remember when I met Nick. I just always feel like I've known you, Nick. And Nick is just one of the most personable guys sitting down in different places that we've talked. So can you give us a little of your background, Nick? How did you get into brain injury research?
Sure, I'd love to. Thanks so much, Catherine, and thanks to the organizers as well. And thanks to all of you for taking the time today to be a part of this. Pretty awesome in this virtual world to be able to connect with so many. So this is great. So my background, I'm an occupational therapist by clinical training, and I'm a researcher with a significant focus on pediatric concussion. And my research has really focused on helping youth get back to the things they need, want, and love to do, whatever that might be. Could be sports, could be school, could be hanging out with friends, whatever that is. I think there's value in having that discussion and working with our youth and the people in their lives to help them do the things that are important to them. And for me, my goal with my research and where I am now, I always wanted to combine, at least originally, sport and occupational therapy. While I was training to be an occupational therapist at the University of Toronto, we had a full year research project, and I was lucky enough to be linked up with a hockey team where we measured head impacts during hockey play, both in male teams, but also female youth hockey teams. And from there, I just caught the research bug and really wanted to further establish a role for occupational therapy in the field of concussion and brain injury. And I've had a great time doing it. I'm so fortunate to do research specific to treatment, assessment, but also education and behavior change, and seeing how can we get the right information to young people, and how do we empower young people to help each other is a big focus of mine as well. So yeah, again, really pleased to be here today, and I know we're going to talk about a lot of great things. So thank you, Catherine.
And Nick, there's so many different angles we can go with the resources. And I've always loved the stuff that you produce. You really, you know, whether it's finding the right designer or what, but the stuff that you put out there makes you want to read it. It's easy to read, and it's approachable for kids. So you really have an eye for that. And I also want to congratulate you because there's a big announcement, I think it was yesterday, that you were given a National Research Chair. Can you explain what that is for non-Canadians?
Sure, and thank you, Catherine. I'm very honored to be awarded a Canada Research Chair yesterday in pediatric concussion. So this is a national research award aimed to support research and activity in various fields in Canada, across Canada, at various institutions, and in my case, specific to pediatric concussion at the University of Toronto. So very honored, and I'll say it related to this award, but also the materials you mentioned, Catherine. It's really not just about me having a feel for these things or a good eye, but it's about partnering with the people that need them and really working with amazing collaborators all across the board. So that's part of the fun for me, to build relationships and learn from others. And I think the work I do, but also the Canada Research Chair, will allow me to continue to do that more. So thank you very much.
Well, I think the collaborative nature of all the Canadians is really amazing. And I just know you meet one Canadian and it seems to stream into other ones. And the person that really, you know, introduced me to Canada is Angela Colantonio, who also received a reward yesterday. Do you want to talk about that exciting addition to so many awards that you have been given in the last couple of years?
Well, thank you, Catherine, and good afternoon, everyone. It's really a pleasure and honor to be with all of you today with my outstanding Canadian colleagues. And I just want to also take the opportunity right now to recognize Catherine for her incomparable ability to raise awareness about female brain injury. And we would not have the same level of awareness without pink concussions. And so I'm grateful for all that she does in support of researchers and the researchers that are involved in her events, and for bringing us all together to discuss important issues like sex and gender. And also congrats on the great brain injury professional edition on women and brain injury. And we have been inviting Catherine to our events in Canada too. Like she's very welcome in our events, and we've been really pleased to have her. So I as you mentioned, I do have a new Canada Research Chair. The title of the chair, which was announced yesterday formally, is Traumatic Brain Injury in Underserved Populations. So that's going to be a major focus. It's been a major focus of our lab. In terms of training, I know Nick talked about his background as an occupational therapist, and that was my original, undergraduate clinical training, which is shaped my research, and I believe it's holistic. And as a profession, and when it's at its best, it's one that works collaboratively with clients to reach their goals, to address their goals. So I like to think that our research is very informed by stakeholder perspectives and users. And it's been an honor to be mentored by persons with lived experience of brain injury. And I want to recognize all of being part of our collaborative research initiatives. Also, I want to thank Brain Injury Association of the USA for recognizing our research program, and organizations like Brain Injury Canada, who's always, had, they really wanted to feature sessions on brain injury and sex and gender. I
think there's a very collaborative nature in Canada. and certainly with the researchers are working with each other. And I am impressed the Canadian government had a big grant for domestic violence that Karen and Paul part of it. It seems like that's the research piece is really checked off. How do you think it translates, Angela, to actual having patient care in Canada? I know that you have a different medical system than we are. Do you find that women and girls with brain injury have access to the care they need?
Well, that's a huge question in terms of access. Like in Canada overall, we do have a publicly funded and publicly administered healthcare system. It doesn't account for everything, but it does cover all doctors and in-hospital care. And with some exceptions, like some contribution to long-term care, home care. So, so from that point of view, from terms of access, we do have, so that, you know, persons should have universal access to those services. And they're portable, the insurance is portable across provinces. The gray zone, however, is that some of the services are not outside of the hospital, outside doctor's visits, are not necessarily covered under the Canada Health Act, which are like things like outpatient occupational therapy or physical therapy. That can be covered by private insurance, for instance. So I don't know if there's been a cross-border comparison in terms of access to care, but we do have this publicly funded healthcare system.
And in your research, you did find that women, and I think it was the Canadian part, that women were less likely to be prescribed outpatient resources compared to men?
Well, what we found in one study, which is on hypoxic brain injury, we combined data. So because we have this publicly funded healthcare system, we can actually capture people in the healthcare system with a traumatic brain injury diagnosis. And so that has been an enormous resource that we use in our research. So for instance, we found that in one research, we combined data from inpatient to who gets to inpatient rehab. And we found that for hypoxic ischemic brain injury, women were less likely to be in inpatient rehab after the injury compared to men, like almost twice as likely not to be in the system. What is the reason for that? We don't know. Could it be that they were not prescribed to go? Could it be that they were prescribed and did not go? Could it be that the service offered did not meet their needs? These are all questions that need to be answered. But I do want to say too about one of the reasons our research has benefited in some ways because of our publicly funded healthcare system. We're able to capture people in the system, and we've looked at concussion like in terms of comorbid diagnoses, for instance, within the system. And we recently published a paper that was actually featured on the NIH website that showed that girls, women had more likely to have a comorbid neck injury at time of concussion when they were in the emergency room. And that was over 90,000 concussions. But interesting enough, and this what makes this research very complex, is that it was not across all age groups. It was during the reproductive years. And the other thing what we're able to do with some of the data that emerges from our publicly funded healthcare system, we can track trends over time. Like over a 10-year period, there was like an 83% increase in concussion among girls and women versus less than 20% in boys and men. I don't know, I think that statistic just screams for more research with respect to looking at sex and gender differences.
That's really important, and to see those changes. Are we just more aware that females have concussions? Are there more referrals, or are we doing? And I know that girls more participating in active sports, and I also know for the first time women are drinking as much as men. So you know, where does that come in? And I want to segue to Andrée-Anne. What about your research? I know with the 5P studies, I've always been fascinated about how you can break children down in a way that I don't see a lot of other research out there doing.
Yes, so for our research that we published in the magazine and that was published in JAMA Pediatrics, our interest was to look at development when you have a concussion, but as well look at so different age groups and also look at sex. And so we divided our population into 3 age groups from 5 to 7, 8 to 12, and 13 to 18. And basically these age groups were defined from an assessment that we were using. And neurodevelopmentally, it makes sense to characterize these children in those categories. And so we find similar results as what Angela has found, is that females tend to have more symptoms after having a concussion compared to boys. However, this difference is way more pronounced in the age group 13 to 18 compared to the age group of 5 to 7 and 8 to 12. And so what's surprising is compared to boys, so adolescents compared to adolescent boys, they seem to recover way slower. So their time period to recover is slower than males, and it's considerably slower. So at 12 weeks, females still have symptoms compared to males. The median or the mean are about 50% of males will be asymptomatic at 4 weeks, when this is not the case for females. In fact, 50% of females will still have symptoms by 12 weeks after having their concussion. So that's a bit of the gist of the paper, that females tend to take longer to recover, and overall they have more symptoms after having concussion. And, honestly, it's really understanding. We need to do more research to try to understand, well, why? Why is that? What's going on in the adolescent phase or years that, especially in females, so why do they still have symptoms, or why does it take so long to recover? And that might be developmental. It might be due to their neurons, for instance. The size of the neurons of females are different than the size of the neurons of males in adolescent years. So it might be due to that, or it might be just social as well, right? Females maybe tend to report more symptoms than males, or they might think more about the future, and so they really want to get all the medical need that they need to be able to recover, when males, perhaps that's not their priority. Their priority is maybe perhaps is to go back to sports right away. So they might not be necessarily indicating that they have symptoms on these scales.
This screams to move to Nick, but I just want to hold one more second. Do you think that, the piece with the teenage girls is that age group would mostly have their period at that point, and that transition with neurotransmitters that and female hormones that take place that we wouldn't see in the 5 to 7 year olds?
So that is a good point. It is possible that this is due to hormones. 5 to 7. So for instance, the 5 to 7 year olds, why I don't talk so much about them, it's hard to know if they did their self-report or if it's the parents that did the self-report. So I try to always compare them more with the age group 8 to 12. And at the end of the age of 12, a lot of females will get their periods or their menstruation at that time as well. It's a good question. It might be hormonal. It might be as well just the development of the brain. It might be due as well to their neck, so that the neck of a female is not as strong as the neck of a male, generally speaking. So when you get a concussion, normally the neck can absorb a lot of the shock, but if you don't have the muscles, then it's harder to absorb the shock, and you might get a more severe concussion. So those are all hypotheses. This is still being researched at the moment. It's a big question. Why are females and why are adolescents more prone on having more symptoms and recover slower?
is the 5P study still ongoing?
Well, the 5P study is done. It's been done since 2015. We're still just producing manuscripts or studies out of it. But we did recruit over 3,063 participants for this study. We're now doing other studies that are where we are trying to look into sex differences with males and females in the pediatric population.
Well, your work is very exciting, and I do recommend that people look at the 5P study and the papers that have come out of that. And now I want to segue to Nick. Okay, high school girls, talk to me. This is the group that I've spent the most time working with, and I invited all our interns today. Hopefully we have our interns on there today. Hello, interns. But you know, I have always found that with girls that come completely isolated and they join up and become part of Pink Concussions and part of the intern group and have a purpose, that, you know, grouping girls together seems to, you know, improve their overall outlook and symptoms. So what can you tell us, Nick?
Yeah, so I think this is a common experience for many of us working in the pediatric concussion space, where we tend to see anecdotally, but also in the research data, as you've heard, that adolescent females can have a difficult time getting back to the things that are important to them in their lives after a concussion. And I think, as we've discussed, there's probably many reasons for it. And some of the work that I focus on is thinking about, one in particular that we're exploring now. So we have a project going on across Canada in high schools. And I know we may talk about the impacts of COVID, and you can imagine some impacts on that work right now. But the essence of that project is to empower young people to help each other. So to create concussion clubs within high schools that are going to provide the right resources and information and support for high school students to be that peer example for others, to raise awareness and really change behaviors. And one of those behaviors we're trying to change with this work is the idea of providing social support. So the provision of social support to a peer who's had a concussion. And the reason we want to focus on this is we did some preliminary qualitative research focused specifically on high school females. And we wanted to ask them, what does social support mean to you related to your concussion? Did you have it? Did you need it? What was important? And what we found was that there was some really interesting themes that emerged here. And social support certainly is something that many young females struggle with following their injury. Interestingly, we found that there were three main themes. One was social support from close friends, and that's something we would sort of expect. This idea that young people rely on their friend group for a lot of support for many issues, including potentially injury and concussion. And what they needed from that close friend group was social inclusion and to not feel isolated. So looking for strategies on how to enable this idea of feeling connected to people, and giving friends strategies to help their friend who needs that support when they have a concussion. We also heard some different ideas around social support. And one was this idea of connecting with other youth who have had a concussion or have had this experience of having a concussion. And what that proved to bring to the lives of these young girls that had concussion was this idea of empathy and validation for what they're going through. So that was quite interesting. And then finally, although we tend to think, I know I have 3 young kids, not quite teenagers yet, but they will be, that teenagers tend to rebel against their parents and maybe look to their friend group for support. A clear theme was that young people, these females, do need their parents as part of this process. And that support that their parents provide is assisting with practical challenge or flexing their adult power to really make sure that they can step in and provide some advocacy with the school or healthcare professionals. So I think in essence, one of the contributors potentially to prolonged symptomology or prolonged deficits or poor health outcomes for this female adolescent group could be this idea that we just don't have the right strategies in place to promote social support and strategies to do that across the board, from friend group all the way to mom and dad. And I think if we come to some really concrete strategies and clear ways to convey that information to young people, perhaps we can make a big difference.
Yeah, and I totally agree with you. We have had our interns start either team concussion is what they called if they were co-ed school or Pink Concussions Club. We've definitely had interns that have run clubs at their school. One of the pushes in America is that junior year stress of applying to colleges. So a lot of the clubs have been started by leaving seniors or rising seniors, and we don't get the passover to the next group. I've always hoped that we could do it in middle school where the kids are able to, that they would go into high school and already have that set up. But if you could have healthy kids that haven't had concussions, supporting them even before the concussion starts. I've seen it in the short-lived clubs that our girls have done to be incredibly helpful. We have also done Big Sister, Little Sister, where you just get hooked up with another person that may be similar to your sport or the injury was different. So I totally believe in everything you're doing, Nick.
Yeah, well, that's great. And yeah, I agree. I think there's plenty of room for exploration on when we do this, how we do this. But I think in principle, it's really shifting focus to giving youth some power in the situation, right? Empowering them to be a part of the solution and to implement solutions that matter to them. But if we don't ask them, we won't know, and we can't do that. So I think that's really important for us. And the other point I'll make too around these clubs, the nice part is we're extending beyond the tradition of concussion is only a sports injury, right? And only athletes need this information. And we know based on the data of who's seeking concussion care, at least here in Canada, that's not the case. Concussions are happening to many children, many youth for many reasons. So our clubs are inclusive. We're providing messaging to the entire school. We're trying to measure and change behaviors across the entire student body and not just the athletes, which I think is quite unique and very important.
Yeah, no, I totally agree. And the two papers that we published this year were looking at private schools and the concussion culture. The culture isn't the same at every school. In some schools, you do not tell if a teammate has a concussion. Other schools, that is okay. And it also varied between boys and girls. Sometimes the boys would say at a particular school, yeah, we would tell, and the girls said we wouldn't tell. So I think it's important for each school to do a survey on the culture that exists in their particular school. That's another thing we've done with our interns is that we give them, why don't you go with your school and do a concussion survey and find out the cultures that exist in your school, and then move to change the ones that need to be changed. So really excited about the teenage work that it's my favorite group to work with. I do want to wrap around a little bit and ask Angela. So we're all doing concussion research. We have a certain way we do things. We meet in conferences, and then COVID hit. Could you talk a little bit about how the influence on COVID has changed your work day to day, and what you see the pros and cons of how COVID is going to change, sort of the future look for what you're doing personally?
Well, I would say, like for many academics, that we had to shift to an online system of providing courses in virtually 3 days. So luckily we're able to transition to that academically. And then in terms of research, of course, we had intervention studies going. One was an education program that's educating families or persons with lived experience of brain injury, with persons who've had the injury, their caregiver, and also clinicians on sex and gender considerations. And that was going to be in person. And we're still recruiting, by the way. So if anybody wants to know more about that, they can contact me. So we had to totally shift to an online secure format for that. Similarly, we're doing an intervention study on the role of exercise to promote community integration after moderate to severe brain injury in the community, led by one of our students, Enrico Quinilco. And that had to shut down. And so we're looking at, ways in which to proceed after that. One of the the issue around COVID is that also a lot of vulnerable populations, or the kind of inequities of care around underserved population, has come to the forefront, which is exactly the kind of work that we're focused on in our lab. So, well aware of the issue of intimate partner violence, how it's escalated during this time. There's been increased awareness about that. Also persons who are vulnerably housed, as well as persons in the justice system. With respect to COVID, we also partnered with Parachute, a charity in Canada, to receive this emergency funding to address intimate partner violence and brain injuries, supporting women in this context. And we just completed a summit on this topic. We are hoping to write up with stakeholders all across Canada, and we're hoping to write that up and disseminate that quickly and develop resources for the situation. So in some ways, again, it really highlighted some things we really needed to take care of. I think in terms of how we move forward, I don't think all of it, I think a lot of us, both in education, research, and clinical care, are going to be retaining the online. Certainly our rehab services, you know, a lot of patients in many ways welcome the fact that they don't have to travel in and pay for parking and so forth. So anyway, there's some negative things, but also some positive things, and it's certainly accelerated some things we need for the future.
Thank you, Angela. I think that's a really good review. I must say, in the Pink Concussion Support Group, I think we're over 3,900 in the larger group. We have 12 support groups. And it was interesting because when people first went into lockdown and were suddenly trying to figure out, you know, what is lockdown look like, the women with brain injury had already, you know, actually had to step up on that. And I think almost everyone's now experienced where getting cut off from the things that you love, the activities you want to do, the people you want to see. I think there's a lot more compassion for people through that. So I wanted to segue to Andrée-Anne about, you're looking at this population, these younger kids, and in our research, we're so surprised how many high school students had come into high school and had their concussions in middle school. So those high school programs were reaching them too late. Are there things that you want to talk about this group that we don't really talk about too much before any of this? What would you like to talk about, and how has COVID changed it?
So yeah, sure. So the population really that I investigate is between 10 and 18. So 5P is another study that I did contribute to that did look at 5 to 7. Something I think that overall in the pediatric world is something that's I think left out often, just in general in terms of research, is trying to build resiliency in these kids once they have their concussion, right? It's trying to give them the tools of learning how to manage their stress after a concussion like that. It does not increase their symptoms. And so this is what really my research is now focusing on in the age group of 10 to 18, is how we can build interventions to increase resiliency, or the resiliency trait, and in order to prevent the persistency of symptoms after 4 weeks. In terms of COVID, so that's actually what I'm researching now. And in terms of COVID, well, obviously, like many of us, I did end up having to stay home, take care of my kids, while trying to do research. So it was hard. There's a lot of things that were shut down in my lab. So a lot of research. Access to my office was completely shut down. It is still shut down. And so certain analyses cannot be completed at home because I have a lot of neuroimaging data, and that we're not allowed to bring that at home, right? So there is a lot of analyses that can't be done, but at the same time, we needed to switch over and think of another way of recruiting our participants for this mindfulness study that I'm doing, and so we switched to online. and things are starting up now, and we're starting to recruit shortly online for these studies. So overall, it's a bit slower, but I think we are, climbing the hill again, and hopefully in the new year we'll be able to publish a bit more and put COVID behind us.
Thank you. And Nick, the same question for you. How has COVID changed your day-to-day work?
Yeah, so certainly I echo the words of my colleagues, and I'm sure everyone on the line today, many new challenges, unexpected challenges, and uncertainty with the work that we're all doing. I think in particular, professionally, it's, a lot of the work that I strive to do is via creating meaningful partnerships in the community, whether it be with schools, whether it be with sports organizations. And I think right now, those community groups are really struggling to just keep their heads above water, like all of us, right? And whether it's with rolling restrictions or shutdowns or just uncertainty of what's going to happen next month or the month following, it's understandably research projects and these partnerships are lower on the priority list. And I think that's something that is a reality of what we're all experiencing in this wild world, and something we have to be okay with. But I think also continue to build those relationships, provide support wherever I can to any of our collaborators and partners in the community, concussion or not, whatever it is, if we can help, let's get together and do that. And when days get better and the world gets back to a spot where we have the same level of enthusiasm and engagement for these projects, we're all ready to hit the ground running. But I think it's a challenge to try to force the agenda when there's other things going on that we're all dealing with. And I think just personally, as I mentioned, I have 3 small kids, and just navigating this world and the uncertainty and trying to strive towards health for all of us is a challenge. The OT in me is always screaming at me around balance and thinking about pacing ourselves in all that we do. And it's harder than ever to do that. And I know I'm preaching to the choir, but I'm a very positive person, and I think together we can do this. And I think the energy around brain injury in the community is there. People want to be engaged. We just need to make sure we're engaging at the right time for the right reasons. So excited to do that in the future.
And I just want to point out, one of the big differences I've found is that the school nurse, who is the glue that I feel like holds together so much of the health issues in the American school systems, you guys don't have school nurses. So in most of the schools, so there's a community healthcare outside, so that you have to reach out through the community, right, Nick?
Yeah, so certainly, and it varies across different jurisdictions across the country, but generally in the public school system, which is
on the other side, there's a basket of
there isn't much access to
bin that's got stuff in it.
Generally,
Margaret, could you mute?
Sorry.
I'm sorry, Nick. Can you start again?
Yeah, no, I'll reiterate. You're right, Catherine. I think generally in Canada, and of course there's variation across different jurisdictions and different school boards and so on, but in-school nurses is rare, and a lot of those needs, whether it be during COVID times or just general related to identifying concussion and providing support, falls to principals, vice principals, guidance counselors, or those champion teachers in the school. And I think a lot of the work that we're trying to do is to identify who those champions are in the school and provide them with the resources they need, because it does vary quite significantly from school to school.
Thank you so much. I think there's so many other directions to go, but I do want to give the audience a chance. We could go to, I'm going to read through some of the questions, but is there anybody that would like to ask a question to our panel? And if you do, just unmute yourself and ask your question. I'm recognizing a lot of names out there. I'm sure there's a question out there.
I have a quick question. My name's Adrienne. I'm a postdoctoral fellow. Thank you all so much for this conversation and including us in it. I was really curious, and it seems like in the chat there's a lot of energy and excitement about this idea about concussion clubs. And just thinking about group interventions more broadly and some of the challenges that can arise. I'm curious what barriers or what risks you see, Dr. Reed or others, in implementing something like this, and kind of how do you quality control the psychoeducation and minimize risks of kind of not helpful information being disseminated in that context?
Great question and comment, Adrian. Thank you. I think it's certainly something that is very front and center for the work that we're doing. And this idea of fidelity, or what you said, quality control, is essential, right? And I think, we need to build in practices to do our very best to monitor that as we can. And I think, the worst case scenario is we have all these motivated, empowered young people sharing inappropriate and inaccurate messaging, which is not what we want. So what we did on our end to try to address that is we actually deliver the intervention or the club building through an online portal. And that portal is housed with concussion resources that are all, we actually did a paper and we published this using a systematic review process, but doing it but applying that to scanning for online educational resources that are, one, targeted at youth, so with language facing youth in particular, and two, that are accurate, so based on most recent international concussion standards and practices and evidence. So we know that the materials that the students build, and part of these clubs, they're intended to build a concussion awareness campaign, but they need to use these resources on the portal within their campaign. And we also have a mechanism where the students need to report back to us to let us know what's going to be happening, right? So we can do a little bit of fidelity checking along the way, but also being cognizant that we just don't have too many resources to support too many schools across the country. And then on top of that, building into the school culture, having a staff member in the school as part of that club. Of course, it is peer-led, and we want the students being the leaders of their group, but we do want to have some checks and balances from a staff member, at least loosely affiliated, that we can help train and bring up to speed as well. So those are a few of the techniques that we've used, but certainly something we all need to be very aware of when training anyone, not just youth, but healthcare professionals, our students. We need to make sure that the fidelity of what we share is passed on most appropriately. And I think something that's quite interesting to explore, and lots of great ideas floating around, I'm sure.
Thanks so much. Great question. Somebody else out there?
Hi, I have a question. So I was just wondering about the sex differences. So we know a lot about that, but what does that help us in terms of informing prevention work? So the sex differences, what we can, how we can communicate with the different genders based on what we've learned in terms of preventing concussion.
I have a opinion on this one. I think it should be included in elementary school as part of the health class. Even before you start drug and alcohol awareness, I feel like that brain health should already be part of the school system.
It's part in Ontario now, Canada. As soon as
part of Rowan's law? As part of Rowan's law?
It's not Rowan's law. It's just a new law that was brought by our new government, where concussion now they see videos at least as young as junior kindergarten of what is a concussion, what you're supposed to what you're supposed to do if you see a concussion, how can we prevent concussions. So it is starting, at least in Canada, at least in our jurisdiction, we have we're starting to implement that.
I think that's really important, because when I've done talks, if it's 5th grade through middle school, that, you show them, a beat up football helmet and that this person went out and played. In middle school, they're like, wow, that's a really dumb idea. You show it to, somebody that's 16, 17 years old. They're like, oh, well, the college scout was there. No wonder he played. So I think they're more open at the younger ages to get this information into their head.
Yeah, and I'll add to, what excites me about exploring this further is thinking about how we're delivering that education, what types of programs we're creating to convey those messages that are going to help with prevention, whether it be primary, secondary, tertiary prevention of injury. And I think, that's where really tapping into individualized approaches and thinking about perhaps sex and gender, but perhaps many other factors on how we tailor this information to be digested and used most appropriately. So yeah, that's what gets me excited from a research and evaluation perspective, and thinking about how do we most effectively change behavior for certain groups of individuals at different levels in the school system.
Hi, my name is Katrina. Can you hear me?
Yes.
Okay. I would just like to comment on the awareness level for concussions, which is very, very low. So my modest contribution is my documentary about traumatic brain injury overcoming. In it, Dr. Giacino, who is elaborates with medical facts about TBI, and Marilyn Spivak so vividly explains about TBI. And among 5 TBI survivors in the documentary is one female with mild TBI or concussion, popularly called. It is an invisible injury. The concussion is invisible injury, but with devastating consequences.
Definitely. Do you have a question?
No, I would just like to comment.
Okay, and I did see that in the chat, so thank you for sending us that link. I just want to move along because we're almost out of time. Does somebody else have a question?
Thank you.
Hi, Catherine.
Hello.
Hi, it's Malika and Connor Gormally with Concussion Alliance. I was wondering if how we could connect with Nick and your concussion club platform and protocol. Maybe we can do some promoting of the clubs on the West Coast here in the US. We'd be super interested in that.
Yeah, well, that, you know, I'm always grateful for partnerships and collaborations and putting our heads together. And I think just for clarity, we're still in the research validation phase of this project, and we've had a bit of a pause with COVID, obviously, and not able to collect the data as planned last year to really move it to the next level. But I think once we have some of that efficacy data, the goal is to really let this thing catch fire and really spread it. So I think the sooner we start having discussions on possible mechanisms and collaborations for doing that would be awesome. So please reach out to me. I can put my email in the chat, and you please send me an email, and I'd love to just hear your thoughts on it and hopefully plan for the future to do something big and great.
Yeah, sounds awesome.
Sounds fantastic.
I had one follow-up question. The speaker from Ontario who said they have videos for kindergartners. Is there any way we can access that? That sounds fabulous too.
Yeah, so they, I'm not sure if they were released yet. Perhaps I was not supposed to say that. They were created by the Ontario government. The one that I participated in is in French, so I'm not sure if that would be useful at your end. But I think they were done by TBO and TFO. So perhaps they're now up on their website. I'm just not sure if it was launched yet. Nick, do you know about those videos or no?
No, Andrea, and I don't, unfortunately.
They were, yeah, so they were commissioned by the federal, by the provincial government for schools. So perhaps in the near future, you can either email me or, and we can see if they're now up online for with TBO and TFO. Those are.
I would actually like in 2021, since you guys keep showing up for these calls, I'm going to keep having them. So what I'd like to do in 2021 is have Nick and Andrée-Anne and Angela back individually so we can go deeper into each of their research. But as this final call in 2020, I wanted to get just a little Canadian boost in there and then have them come back. Nick also has a return to learn program I want to talk about. I want to go further into Andrée-Anne stuff, and Angela, I'd like to spend some time talking about the abused and brain injured website that she put together with a collaborative people. So there's each one of these people has so many different resources, and they're people that you really should follow along with other Canadians. So let's see, I think we have time for maybe 1 or 2 more questions. Cara?
What I was just going to say is that I remember, working with one medical center that was doing some outreach and going to schools in New York to talk about concussion protocol. And I spoke about, the differences with girls and women, but this school itself just did not have the resources. And these were like private New York City schools. So I just think that it's tricky. And I don't know, as the concussion, brain injury, community, how we can provide these resources and this information, because the school nurse or the coach doesn't necessarily know. And so I don't know, something about, the Canadian programs or the outreach, I think is great, but I was wondering if anybody thinks of any strategies or has seen any outreach done, within schools within the States.
Oh, yes. Can anybody hear me?
Hello.
Hello. I'm Dr. Dorrit Johnson, and I just want to, thanks for having me. I think it was a very informative group. This is my first time in the session. I'd also like to ask if anyone considered, I've not heard any conversation on accommodations. And again, in schools, how is the accommodation process worked out? Or have you done that in any places where there are kids with post-concussion kids?
Nick's program, maybe you could put the link to it, the concussion, it's pretty elaborate. I think it's a 28-page booklet.
Yeah, so I'm happy to share it, and I see some comments asking around Return to Learn as well in the chat. So I'll share a link. We have a resource, and not really a program just yet, but a resource that's now turned into a website with some great collaborators across the country here in Canada, called School First. And essentially what School First is, it's a resource targeted at the school sector, teachers, administrators, to build their toolbox to better support young people to get back to the classroom. So some tips and tricks just to build their toolbox. So I can share that in the chat, but certainly it's, and for both of those comments recently around resources in the schools, accommodations in the schools, it's a challenge here in Canada as well, a disjointed approach. And I think, part of our efforts are to try to bring people together and not sort of reinvent the wheel in too many different areas, try to curate great information and try to share it in the most effective way possible. But I know a challenge we all struggle with, and we're all in it together, I think, no matter where we are, Canada, US, or around the world.
And it really does need to come from websites, because I have boxes and boxes of flyers that are sitting here aging, and I took a whole pile down to mail out, and it was $5 an envelope to mail out some stuff. So, we really have to become more virtually based. The concussion resources in the United States, I recommend Brain Steps by Brenda Egan Brown and Karen McAvoy, and they have a great website called Get Schooled on Concussion. And they have a lot of great resources for the States where you have a school nurse. Now in Canada, and as Nick shared, you don't have that in all cases, so that you're dealing with the school, non-medical school staff reaching out to a clinic. So I think we have time for maybe one more question. Cheryl?
Hi, Cheryl here. I wrote my question in the chat, but I'm thank you for all of the research and work that's been shared today. I'm interested in concussion in older women and the sex differences with older women from falls, etc. And I'm wondering if there's a resource that anyone can point me to. Thank you.
Angela.
Well, I could say that there's not being a lot of, the research on this is not, we don't have a huge amount of research on this. We found that some of the highest rates of female concussion or mild brain injury are actually among older women. And a lot of the systematic reviews don't address this topic at all. Our work is on moderate to severe injury and rehab. We found that both men and women, benefit from rehabilitation, make the same level of gains as persons in inpatient rehabilitation who are under 65.
Can I make a comment?
Pardon?
Oh, I'm sorry. When you're done, I was wondering if I could comment on that.
Okay. I mean, we've looked at some comorbidities in persons in inpatient rehabilitation and found that older women are more likely to have musculoskeletal conditions and also mental health comorbidities, for instance. So those are some research from our lab on that.
I have seen research on falls, preventing falls, and especially when you have when your hip breaks, because your hip breaks in the socket and then you fall. It's a very traumatic fall. So I think that fall research, they went a step further and see what head injuries, brain injuries came after those falls would be a really nice research study. Did you want to comment on that, Cheryl?
Yeah. Oh, I'm sorry. I thought you were talking.
Wendy?
Oh, yes. Is it okay to comment now?
Sure. We have about 1 minute.
I am a geriatric physical therapist and a vestibular and concussion specialist. And you hit the nail on the head with falls. So concussions in older adults are very different than younger sports-related concussions, especially because that you have geriatric syndromes that come into play. And the big one is falls. And then you have frailty, which frailty ties into falls because frailty is a fall risk factor. And then you also have polypharmacy. So those are three big things. And then the other thing too is just the fact that the structure is frailer. The person speaking first, I'm sorry, I forgot the name. The muscle weakness ties into falls directly. But the big thing, if you reduce it down, is falls. And of course, a lot of these concussions are missed because, you know, they come in and the person may be confused and they kind of play it off as, oh, well, they're just old. So yeah, so I know falls is a big reason for sports-related concussion, but really in the older adult, it's falls related to balance impairment.
I think also with women living longer and then outliving their spouses or their partners and living alone. I know as a single mom with most of my kids in college, you know, everywhere I went, I grabbed my phone at night, and there were a couple falls that I took that I lay on the floor and thought, I wonder how long it's going to be till someone gets me. So I do think that that's important. And I think if you got anything out of the call today, it is that women and girls is a group subset that we feel is very important. Everybody turned up for that. But within that, each age, you also could break down to women of color, women of different ethnic backgrounds. I mean, these subsets are important to look at. So in your research, in your practice, what group are you dealing with? What group do you need to have some cultural awareness of to be able to take that research and put it into practice? So thank you guys all for showing up. We extended a little longer today because we had 3 fabulous guests. They'll all be guests again in 2021. Who's so psyched for a new year? Keep it safe. We've got only a couple more weeks to go of this horribly long year, and stay safe, and I look forward to seeing all the vaccinated you in 2021. Thank you, Nick. Thank you, Andrée-Anne, and thank you, Angela. Thank you, IBIA and NABIS, and everyone stay safe.
Thank you, everybody.
Thank you.
Catherine. Thanks,
Thank you,
everyone.
Catherine. Thank you, everyone.
Thanks. This is great. Happy holidays.